Doctor, we have a list. So these are some of the things that you may experience in case you are expecting lightning.
Yes, I mean, definitely if you have some contractions, some of the signs of labor, of course, bloody show, if your membrane's rupture, if you're nesting, any of these signs will definitely be signs of labor. As we know, there's not much difference between false contractions and real contractions, meaning that the false contraction, the only difference is that they disappear after a while the real labor contraction will continue.
Those are the Braxton Hicks ones, doctor?
Those are called Braxton Hicks, and they tend to start around the third trimester, somewhere around 31 weeks or so, sometimes early in some patients, but they happen to be irregular. They're strong contractions, but they are irregular. That's the difference between those and real labor contractions. And of course, you could have a bloody show for multiple reasons, but mainly when you have a severe bloody show is secondary to dilatation of your cervix, and that is definitely a huge sign of labor. Your water could also break, and it could break at different instances. It could break earlier and in premature labor, or could break at term. Sometimes you go into labor before, and sometimes you don't need to break your water out until after you're in labor.
And there's a few more there as well?
Yeah, well, the effacement and dilatation are always signs. Those are the real signs, but those are the ones that we measure in labor and delivery that usually are not being able to be measured at home.
So Janet, what did you experience?
So I delivered him on Friday. Okay, so Wednesday, I started feeling discomfort in the lower back. And I knew from before, okay, this is it. I was convinced that he was gonna be here on Thanksgiving, because Wednesday evening, I got really strong contractions, enough that it kind of stopped me in my tracks.
How far apart were they?
I mean, we're looking at maybe an hour apart at this point.
And that's a good question to ask you, doctor. How far apart when you realize, oh gosh, I better go to the hospital?
Well, I think that, as she was describing earlier, an hour apart, they're not really significant. That should be monitored in the hospital setting. I think it's ideal for you to stay home until they get close to each other.
Close like what?
Well, 10 minutes apart.
Oh, okay.
It depends. Some people at 15 minutes apart should be strong enough that they feel they should go to the hospital. But definitely, 4 or 5 within an hour definitely will be something that you monitor if it's persistent, not just within 1 hour. You want at least 4 or 5 hours of this.